Hello, I'm the master. I've got a box of masks and I'm an AMP, which stands for Approved Mental Health Professional. Today, I'm going to look at what constitutes a formal assessment under the Mental Health Act. There are regular discussions among AMPs as to what constitutes a formal assessment. The main argument is along the lines of, has an assessment only taken place once an AMP and two doctors have interviewed the patient? Even more contentiously, I've come across AMPs who have considered that even if both an AMP and two doctors have interviewed the patient, if a decision is then made not to admit the patient, it was not a real assessment, and they did not therefore have to write a report. I am of the view that it all depends on whether or not the AMP has their AMP hat on at the time they are considering whether or not a particular person needs to be admitted to hospital under the Act. And just as a matter of interest, this is my AMP hat for the day. Assessments under the Mental Health Act all begin at section 13.1. This states, if a local social services authority have reason to think that an application for admission to hospital or a guardianship application may need to be made in respect of a patient within their area, they shall make arrangements for an approved mental health professional to consider the patient's case on their behalf. AMPs do not generally drive around looking for someone to detain under the Mental Health Act. All assessments begin with a formal request to assess someone with the explicit outcome of detaining them in hospital. This can come from a wide range of sources: GPs, hospitals, community mental health professionals, the police, ambulance crews, and relatives. Once a local authority has received such a request, the task of taking the request forward is delegated to an AMP. The crucial wording mentioned in both section 13.1 and 4 is that the AMP should consider the patient's case. This is with a view to making an application for his detention and admission to hospital. By the way, the Act makes an assumption that not only are all patients male, but that all AMPs are male too. As the AMP Workforce Review noted in 2019, 69% of AMPs are female and only 31% male. So it goes. The AMP is acting as a free agent. The Act explicitly states that a local authority cannot instruct an AMP to make an application. It is their decision alone, but they will take into account any information they consider relevant and indeed conduct those inquiries however they see fit in accordance with the requirements of the Act. Section 13.2 makes it clear that before making any application, the AMP shall interview the patient in a suitable manner and satisfy himself that detention in a hospital is in all the circumstances of the case the most appropriate way of providing the care and treatment of which the patient stands in need. It is very common for AMPs, once they have received a request, to immediately arrange for two doctors to attend an assessment. However, there is no legal requirement to convene such an assessment team as the first step. An obvious example of where this is not necessarily indicated is a request to assess a patient detained by the police under section 136. While an assessment involving some sort of face-to-face interview with the patient in accordance with social distancing guidelines is required, section 136 only states that an AMP and one medical practitioner must conduct that assessment. It says nothing of two medical practitioners. Bearing in mind that only around 1 in 10 of people detained under section 136 are subsequently admitted to hospital, unless there are very clear reasons to justify involving two doctors in the assessment, for example, where the patient is well known and is clearly relapsing, it is perfectly adequate and fulfills the legal requirements for an AMP to only use one doctor, albeit one who is Section 12 approved. In AMP hubs, which are managed by an experienced AMP who triages all the requests and decides whether or not to allocate the request to an AMP for further consideration, a few simple inquiries, including something as basic as speaking to the referrer, can often result in no further action needing to be taken by an AMP. There are clear situations in which an AMP will need to convene a full assessment. Such situations include detention under 1 through 6, although we don't necessarily need to have two doctors, a hospital detention under Section 5.2, or a request for a patient already detained under Section 2 for assessment to be detained under Section 3 for treatment. But there are many situations where a formal request may not result in detention and may not involve an admission. Requests from nearest relatives, while they have to be acted on, frequently do not result in convening two doctors and an AMP to assess the patient. There is a reason for this in the Act. As the reference guide points out, AMPs must be satisfied that detention in a hospital is the most appropriate way of providing the care and medical treatment the patient needs. In making that decision, AMPs are required to consider all the circumstances of the case. In practice, that might include the past history of the patient's mental disorder, the patient's present condition, and the social, familial, and personal factors bearing on it, the other options available for supporting the patient, the wishes of the patient and the patient's relatives and carers, and the opinion of other professionals involved in caring for the patient. The Code of Practice goes on to say, before it is decided that admission to hospital is necessary, consideration must be given to whether there are alternative means of providing the care and treatment which the patient requires. This includes consideration of whether there might be other effective forms of care or treatment which the patient would be willing to accept. An AMP must always have in their mind the basic nature of their role, to provide an independent decision about whether or not there are alternatives to detention under the Act, bringing a social perspective to bear on that decision and taking account of the least restrictive option and maximising independence guiding principle. I always felt that I was an AMP 24 hours a day, 7 days a week. It all depends on whether or not I have my AMP hat on. If I am on duty and I am allocated a request, then I definitely have my AMP hat on. Everything I then do in response is as an AMP and acting under the AMP Act. In considering such a request, an AMP may spend several hours before reaching a decision as to whether or not to call on two doctors. They may speak to relatives and other professionals involved with the patient. They may read case notes and reports of other AMPs who may have assessed the patient in the past. And of course, they may speak to and interview the patient themselves. Something I like to do, if at all possible, especially when I receive a request from a crisis team or community mental health professional, is to conduct a joint visit with a professional who knows the patient to make an assessment as to whether or not they are likely to require admission to hospital. Often, alternatives to admission can be found. It's also possible to reach the conclusion that as an AMP, wearing my AMP hat, the threshold for detention is not reached and admission to hospital under the Act is not appropriate. That would be my decision as an AMP. So why would it be necessary to involve a further assessment with doctors if that decision has already been made. It can, of course, also work the other way. When I worked within a community mental health team, there were times when I would visit a service user as their social worker or care coordinator, but based on the person's presentation, suddenly find that my AMP hat was slipping on, and realising that a formal Mental Health Act assessment was going to be necessary. So, my basic argument is that when an AMP is acting as an AMP, in accordance with their legal duties under the Mental Health Act, those actions equate to a formal assessment under the Act, whether or not one or more doctors have been involved in that assessment, and whatever the outcome. Well, again, if you've got as far as the end of this, thank you for listening.